Every aspect of school life has changed, really.
This will be a return to school, a September like no other.
We're going to have a very heavily staggered start and finish to the school day. We are asking students to stay in their classrooms so that we minimise the amount of movement around the school.
A whole new set of structures to protect staff and students.
We are increasing the length of lessons. We can't any longer have assemblies. Everything from the beginning to the end of the school day and outside of the school day is different.
Rebecca Poole, head at Hampton High in Middlesex, has spent the last weeks and months preparing for this moment. They are painfully aware of the cost of so much time already lost.
The children who need us most have inevitably lost out, I would say, from lots of different aspects of school life. It's not just about the learning, it's about the socialisation, it's about the nurture they get from us and the people around them, it's about working in partnership. And I think this has probably had quite a devastating impact.
There has been some discussion of late about how kids will go back to school, occasionally even if. But the biggest question is how it is to be sustained if there is an outbreak, local or national, something about which teachers are confused.
I know that we have to isolate them, and we do have a dedicated room for isolating those people. We would contact home, and from then I am making the assumption that test and trace will work, and we will be informed if there is a positive from a test that is then taken, that we will then be informed and advised about the next steps to do. I'm not clear about the levels of how we would need to shut the school down if that were necessary.
Has that guidance not been made clear?
No, it hasn't.
Government says that those measures are in place.
We've set out a very clear system of controls for every school to be following, whether that's primary school or whether that's secondary school, whether it's making sure it is maintaining good hygiene and good distancing and good flows of pupils moving through the schools, staggered starts. All of these measures are about ensuring children remain safe and those who work in schools remain safe.
But there's a clear risk here. Even if we don't see another national lockdown, local interventions could dramatically affect the education of large cohorts of students, as in Dundee today, where a school has been closed after an outbreak. There isn't much sense of what happens to those kids, short or long term.
I think if there are more significant lockdowns, we know that will have a very serious impact on learning. And there will be two consequences of that. One will be that it will damage the capabilities of children, their productivity, their ability to be successful in the workplace in the future. It will have long-term, what economists call scarring effects on many young people. We also know that it's likely to widen the already very big disparities between the learning outcomes for young people from poor backgrounds and the rest of the pupil population.
And then there is the politics, which at this point, after a season of missteps, is at a critical point.
The government, like administrations across the UK, has had a torrid time in education in these last weeks. But Gavin Williamson does feel especially vulnerable. The patience of Conservative MPs after the exam debacle is already wearing thin. And unlike exams, school reopening affects every year group and every child. Williamson has said that it is his priority to reopen schools safely and comprehensively. But with an opposition intent on building a narrative around government competence, Number 10 knows they can't afford for this to go wrong.
In educational terms, the closure of schools is, on every metric, a policy catastrophe. But in reality, it wasn't government which doomed them to closure in March. It was the fear of parents who were taking their kids out in greater numbers with every passing day. In the end, it will be the management of that fear which will determine for how long they remain open again.
Lewis Goodall, well, Professor Russell Viner is an advisor for the Government Scientific Advisory Group for Emergencies and is Britain's most senior paediatrician. Justine Roberts is CEO of the Parenting Forum Mumsnet. And David Simmonds is a Conservative MP who sits on the Education Select Committee. Good evening to you all. Russell Viner, you heard there that one of the biggest things is going to be the fear factor, particularly among parents. But what are the risk factors for pupils going back to schools? I mean, different risk factors, presumably, for primary education and secondary.
Absolutely. I think we need to look carefully at balancing these risks. There is the risk balance for children and young people themselves, and I think the evidence is very clear for them that benefit is about going back to school. For parents, teachers and the broader population, we have a different set of risks we have to balance. Again, I think that fear has played a major role in this. We need to go back to the science and be reassured.
But also, and we heard there from the head teacher, Rebecca Poole, that she doesn't yet know what the plan is. And of course, certainty is something that, you know, gets rid of fear. I wonder if there is certainty about when a school should lock down or not. Is it when one person's infected, 2 people are infected, 3 people are infected? What happens?
We have a lot of uncertainty. We're not going to get rid of that quickly. And actually, questions about is it safe, when exactly should schools do what, coming from on high, is probably not going to help people. I think we need clear guidance on areas to work on, but we need local action. We need good links between schools and local public health.
And central government, because the central government has made it very clear that a school's only to be locked down in extremis. And that's a judgment that might be taken at local level, but that might not suit the government.
Absolutely. But look, we just don't have the information. What information we have is very reassuring. There's a number of studies. In fact, the studies are coming out daily. I've had 2 emails today about new studies coming out over the next couple of weeks, again, which are generally reassuring, that tell us children play a very limited role, and schools do as well, in transmission.
But then we've got Dundee, where all in all we've got actually a very substantial number of teachers who are infected and a school has gone into lockdown.
Absolutely, and that's about adults. And if you put adults together in institutions, they can transmit viruses. But the important thing is that there's very little evidence that children and young people transmit.
But if you don't have Justine Roberts, if you don't have the teachers in the schools because they are transmitting, then you can't have the school operating. And I wonder if people who are contacting Mumsnet think that there is a clear plan in place or not.
No, I think there's a lot of anxiousness on Mumsnet about the safety aspects, in particular how bubbles will work, how testing will work, how will parents know when there's an outbreak, how soon the school will be shut down, will it be shut down immediately? There seems to be some inconsistency. We obviously have users from all over the country and they report different plans in different schools, and that makes parents nervous. I mean, broadly speaking, our users want the schools open and they are very, very keen, not surprisingly, for their kids to go back. And they're exceedingly worried about the mental health issues. I don't think it's beyond the government to come up with a clear plan and a plan B, quite frankly, a contingency plan.
Well, let me put that to David Simmonds. I mean, it's not beyond the wit of woman or man to come up with a plan. And this has been going on for 4 months in the sense that you hoped to get children back into school before the summer break. You didn't. Why is there not a clearer path here about what schools, what people can expect from their schools?
The guidance that was published by the government on the 6th of August, which updated the plans that have been in place since schools closed back in March, sets out exactly what will happen in each of these situations. And the primary response will be through local Public Health England health teams. Having spent 22 years in local government, primarily responsible for education, during which time those teams have had to manage responses to everything from meningitis to SARS to MERS to swine flu, some of which resulted in the deaths of children in my local area that we needed to respond to. We're very familiar with dealing with that. And the primary response that's set out in that guidance is if there is an incident, those teams will be involved. They'll undertake an assessment very quickly about what needs to happen next. And that will then inform a local response based upon the size of any outbreak and the risk factors that may exist in that local community.
But you heard Rebecca Poole from Hampton High School saying that she is not clear what's going to happen. And then again, we hear from the government today that there actually might be some kind of rota system. So that if one school had to shut down, I assume it means that children would be farmed out to different schools. When's that going to become clear?
Well, as Russell just outlined, there are a lot of uncertainties about how a disease like this, which is new to science and new to medicine, will impact upon schools. What we do have is those local teams that are very experienced in managing all kinds of difficult medical situations that arise in schools and responding accordingly. And what the guidance set out, and I've read it, and certainly at the Education Select Committee, we scrutinised a lot of the planning that went into this process before the parliamentary recess earlier in the year. What that seems to suggest is that government has set out a flexible range of responses, which include everything from closing a school and sending everybody home through to an isolation process for children where there is a known risk and for staff where there is a known risk. And a lot of that is in the context of existing health and safety plans.
Justine Roberts, are you clear what would happen if certain children had to isolate and go home? Who would teach them? Was there teaching packs? Are you getting a sense that people know what would happen if there's an outbreak and if their child was told to self-isolate?
I don't think people are particularly clear about what will happen. But I think more importantly, if we do, and it is quite likely, let's face it, as we head into winter, that we're going to have another period or another second wave of lockdown, or it's certainly regional lockdowns. It's quite clear from our forums that the provision for home learning is incredibly patchy and has been incredibly patchy. And in particular, it's clear from Mumsnet that provision in state schools outside of the sixth form has been way worse than private schools are able to offer. And that's just not good enough. And one thing the government needs to do going into this is get that right. Kids need to be able to learn. And let's face it, it's largely women and mothers who pick up the burden of this. And they're suffering too because, many of them have either been forced out of employment or left employment voluntarily over this period. So the government needs a women's strategy. They need to focus on education as part of that, but many other things too.
So let me just, Russell Viner, coming back to what's been happening in Scotland. Scotland has made a decision that children over 12 will wear masks, for example, in corridors and so forth. Is that a good idea, by and large, for the general population? Should that happen in England?
The evidence on masks is very unclear. And actually, I think that's, in one sense, potentially going beyond the evidence we have. There's lots of concerns about mask wearing for children, particularly younger children. It actually, because they touch their face, they're constantly worried about the mask, that actually could potentially spread the virus more. I think for young children, we're very clear that it's not a good idea.
No, it's not. So over 12.
For teenagers, again, I think we don't have the evidence that this is useful. And I think we need to look at the way that teenagers transmit this virus. The evidence that they transmit in schools is not very high. There's interesting issues about the difference between in school and out of school. And I get that actually people are worried about young people and teenagers and their behaviour, but actually very little evidence for the use of masks in schools.
But what about teenagers who transmit, perhaps to parents or grandparents, and the worry in multi-generational households that there's going to be a lot more of this, it's going to be virulent in schools, but they may be asymptomatic?
So I very much understand those fears, and I think we absolutely get the concern that many vulnerable people have. But if we go back to the science, if we go back to the evidence, young people appear to be as likely as adults to get the virus, and they can transmit. But in general, we're not seeing large levels of transmission in schools.
So, David Simmonds, Matt Hancock has said there's to be 100% track and trace for all this to operate successfully. How's 100% track and trace going to work? What is 100% track and trace?
The schools already have very detailed information, both about the children and the family that are connected to them. It's part of what schools collect for every child. And as a dad of a child who's starting school in a few weeks' time, I've been through this process myself. So they're in a very much stronger position than shops or offices would normally be to identify who's been in the building and who's been in contact with whom. And because you already have those local authority public health teams that are used to intervening in these type of situations, for example, where there are concerns about outbreaks of transmittable diseases in schools, contacting people, tackling that swiftly. They've got the experience to get in there quickly and do it. But I totally agree with what's been said, that there's a key message here that's about reassurance. We need to make sure people, parents in particular, are having those fears addressed. And that in particular, this point, which we really pushed the department and the education unions on that there needs to be really effective online learning. So if a school does have to go into lockdown for a period of a few weeks, there's an arrangement in place where those children...
Well, one brief last question to you, David Simmonds. Given that children have missed so much of their education, if there are intermittent lockdowns, local lockdowns, do you think now that the schools should go on next year into the summer in order to make sure children have a full school year?
I think we need to play this one according to what the virus throws at us. It's very clear from the lessons we've seen of some state schools and many private schools that really effective catch-up learning can be provided. We know that we have had schools disrupted in the past, not just by illnesses that have broken out, but also by things like bad weather, by crises that have affected the school building. So we know that it can be caught up with, but it depends very much on how much time is missed. At the moment, I think everybody is focused on making sure that we have a really good start to the school year next week, that parents, that teachers are reassured. And of course, if we see a big rise in cases, we'll need to respond to that. If, as seems to be happening in other countries that opened their schools some time ago, the numbers remain extremely low and the situation remains stable, then I'd be positive that we'd be able to see a school year next year that looks pretty much like a normal school year for most of those children.
Thank you all very much indeed.